cirrhosis, certainly that's going to lead to them being jaundiced in nature. And any of our cholangiohepatitis conditions can cause them to be jaundiced. So it's not all hepatic lipidosis, but when we see it, we know it's abnormal. We need to address it. They're not going to eat, so we want to stave off any hepatic lipidosis that hasn't already occurred. They're like, oh, it's been 2 days since Fluffy's eaten. Bring him in today. Don't wait until next week. I know it's Friday, just bring him in today. I'd rather spend the weekend with Fluffy now than all week with Fluffy next week. I talked about having that abdominal pain, so if they have that, you're like, okay, is that your liver? Is that your pancreas? Please don't be hepatic lipidosis. We run our labs, we kind of see, okay, we got a neutrophilia, elevated ALT. The ALT being higher than the alk-phos tells you there's more of an inflammatory component. We'll go through our usual diagnostics. They may be hyperglobulinic, so we got to put FIP on the list. We go, okay, how old is this cat? Oh, he's 2. Oh no. So some of these cats will have abdominal effusion. They may have a pure transidate, a modified transidate. When we get that fluid out of the abdomen, we want to determine whether or not they have a higher globulin fraction than the albumin. That's going to be our clue that maybe it's FIP. Certainly, what do we need if we want to rule out FIP definitively? Biopsy. We need a biopsy of some abdominal contents. Some of those FIP patients will be a dry FIP, so that makes it even harder for us to diagnose them. Randomly, we might see gallstones in our patients. We often will see that with the suppurative form, so antibiotics will be part of our treatment of those patients. We're getting a little braver about culturing bile. The surgeons still kind of twitch when you're like, yeah, while you're in there, can you give me a sample of bile? And they're like, wait, you want me to stick the gallbladder? I'm like, yeah, do a centesis. They're like, are you kidding me? They're like, radiologists do it all the time. They're like, sure. They're like, but you're looking at it, just get it. And these are the conversations we have. Man.
Why are they afraid to poke it?
I think just in previous history, you get that person that said, oh, I did an aspirin of the gallbladder, and then they ended up with a horrible peritonitis and died. But I'm like, but we have better tools now. That was like 30 years ago. Why are you so afraid? So, sometimes you got to talk to surgeons and stuff. They want everything to stay healthy. That's why they do a lot of orthopedics. Everything orthopedic is healthy. It's going to survive and go home. We want to do exciting things. We're like, yeah, let's go ahead and like resect this and put this together. And the surgeons are like, is it going to die? Don't worry about that. Just do what I tell you to do. And then they're like, I don't want it to die. And you're like, look, you're a surgeon and you're not. Like, you don't want me to do the surgery, right? And they're like, okay, I'm going to do it. All right, so for us to diagnose these patients, we need a piece of the liver. We need to figure out what's going on. Now, in terms of biopsying cat liver, laparoscopy is probably our best modality. Ultrasound guided can be okay, but we do know that with some of the biopsy instruments that have a trigger and like shoots into the liver quickly, it can actually create a reaction in those patients. They can have severe vagal response to that, and then you get cat that like crashes and burns. So we do have to be careful about how we get biopsies from kitties using ultrasound. So our suppurative cholangiohepatitis patients, as I mentioned, whatever you need to do supportively in the hospital, but these guys need antibiotics. Our focus is our gram negatives and our anaerobes. Most of these patients you're going to treat for 4 to 6 weeks. So usually I'll do 2 weeks of antibiotics. Before they run out of antibiotics, bring them back in. How's the ALT level doing? Oh, the ALT is coming down. Okay, here's your next 2 weeks of antibiotics. You go through that cycle. If you get a client that's like, yeah, I don't want to pay for an ALT every time I come in, then do 4 weeks of antibiotics, bring them back in at the 3-week mark, check their ALT, send them home with an additional 2 weeks of antibiotics, come back at the end, check their ALT. Everything else is supportive in nature. For some of these cats, if they're not eating, they're not getting those fat-soluble vitamins circulating through, so they may need some vitamin K to keep them from developing coagulopathies. Actigol is great for improving biliary flow in these patients. You guys know Actigol? Do you guys review the slides? It was Actigol. Which name? Okay, so all right, we're getting there. All right, so it's a water-soluble bile acid. So that helps to balance out those hydrophobic bile acids that kind of clump together. So we add more hydrophilic bile acids to the system. Hopefully that'll help keep things flowing through the biliary tree. You do need to make sure that your patients don't have biliary obstruction before you start them on Actigol. If they're icteric, I have to make sure that the bile duct is not obstructed. So if they're already icteric, I'm like, you don't get any Actigol until I stick a probe on your gallbladder. Appetite stimulants, we gotta get the kitties to eat. If this is gonna be a long process and they don't wanna eat, especially if they don't wanna eat in the hospital and you're like, I don't know, I don't wanna send you home, not eating, you know, give them an E2, keep it moving. Our lymphoplasmacytic patients, steroids are going to be our mainstay for these patients. Again, we need to make sure that we ruled out lymphoma as a potential cause for what we're seeing, but we put them on steroids and then taper to an effective dose. You may have to give them additional immunosuppressants, but cats are less sensitive to the icky side effects of steroids, so we don't have to worry about as much PUPD as we see in dogs. Other supportive treatment, if there's a suppurative component, then we need to make sure they get antibiotics as well. Biliary cirrhosis, you get them a Christmas stocking now. Dietary supplements, we can give them colchicine, that helps with fibrosis. If they have ascites, then we're going to do abdominocentesis to relieve the tightness of the abdomen. We can put them on spironolactone to see if that will help with the diuretic effects. It's a weak diuretic, so it's probably not going to help much. Lasix is probably going to dehydrate your cat, so I'd rather just tap their abdomen every couple of weeks to keep them comfortable. Question?
What was the colchicine for? You may have said it, and I wasn't paying attention.
It's antifibrotic.
Antifibrotic. Okay, thank you.
All right. Acetaminophen toxicosis in cats. It's the best way for your boyfriend to get rid of your cat so he can move into your life.
Damn, Tony. We're famous.
Look, when we talk about the lower urinary tract system, you're going to understand why the boyfriend wants to off the cat. Okay. So, common questions your practice will get. Somebody calls, they think their cat's in pain. Can I give my cat Tylenol? Oh, no, and absolutely no. We have better drugs for that. Please bring your cat in. And then they do it anyway. Let's hope that in that rare case, maybe they were taking it themselves and they dropped it on the floor and they just had that cat that was going to snuffle it up. They say, my cat just took a Tylenol. What do I do? Bring that sucker in right now. Because if I can get it to vomit and if I can start treating it now, maybe he'll live. If I see him and his mucous membranes are already chocolate, we'll give you a kitten on your way out. You're saying that's what happens. I'm like, how about we just give you a kitten to start with? Don't give a Tylenol again. All right. So, like I said, our ability to treat these cats is completely dependent on when they got the Tylenol. They just got it, owner brings them right in, you can save that cat if you have N-acetylcysteine on your shelf. If the cat had the Tylenol like 4 hours ago, we're going to start praying, the cat had it yesterday, you can try to do all the heroics, but yeah, it's going to be futile. So in these cases, these are some of those rare cases. I'll say, how can we just let Fluffy go and talk about not giving our cats toxic things in the future? All right, in terms of N-acetylcysteine, you do have to dose these guys multiple times, and the dose range changes based upon that timing. So you have that information in your notes, and you can always look it up. So everything else in terms of managing these patients is supportive in nature, but we got to give them the antidote and give it repeatedly, and hopefully allow their liver enough time to go, okay, I got a glutathione precursor, maybe I can manage some of this Tylenol and break it down in my system before it kills me. So that's basically what the N-acetylcysteine is doing. It's just giving them additional glutathione precursors and trying to give the liver a chance. Anecdotally, those that have seen or heard of oxyglobin, it contains N-acetylcysteine. So if you have that and the patient has that hemolytic component to their condition, it'll act as an oxygen carrying component. Most of us don't have any oxyglobin on our shelves anymore because it's, you know, got some variable availability. But if you happen to have it, it's a good option for those patients. Is there a question over here? Okay. All right, let's stop here. We'll touch on hepatic neoplasias tomorrow. We'll do some cases and try to wrap everything up. All right, groups, send up your sheets, your treatment sheets. All right, we got a good sized catheter here. Oh no!